These days, everything costs more. I know you feel it in your bank account, but it really hits home when you step back and you look at the numbers. Take, for example, housing prices. They went up 6% from a year ago. Food, up 11%. And electricity, well, that's 15%. It is hard to make ends meet, especially when you're on a fixed income like Social Security. To help with that, Social Security is announcing the largest cost of living adjustment since the 1980s at 8.7%. Let's dig into it. There's about 70 million Americans on Social Security and supplemental security income impacted by the adjustment. On average, they'll see their benefits go up by $140 per month starting in January. The Social Security Administration made the announcement over YouTube.
Substantial Social Security Cost of Living Adjustment, or COLA, will also bring more support to seniors and others who count on the benefits you've earned for everyday costs.
The Social Security Administration can't decide the cost of living adjustments on its own. There's a set formula established by Congress back in 1972. It was to automate the process. Before that, benefits were only increased when Congress passed special legislation. In all that time, 2023's adjustment of 8.7% is the fourth highest one ever enacted. The highest was 14.3% in 1980. The lowest, a 0% increase in 2010, 2011, and 2016. So that's this year's COLA, cost of living adjustment, giving people more money on Social Security. Plus, some lawmakers want a bonus payment to also go out. But not everyone's on board. WFMY News 2's Tanya Rivera verifies.
Would a bill give Social Security recipients an extra $2,400 per year in benefits? The sources: Social Security Expansion Act bills in the House and the Senate, the Social Security Expansion Act fact sheet, and Mary Johnson, Social Security and Medicare policy analyst for the Senior Citizens League. The answer? This is true. Yes, a bill would give Social Security recipients an extra $2,400 per year in benefits. The bill has been introduced in both the House and the Senate, but, yes, here's the but, here's the thing, an expert told Verify it is unlikely to pass in 2022.
So that bill's not passing, but you are getting more money from Social Security through the COLA. But that doesn't just mean it will get taken up in other ways, does it? Like increasing Medicare costs? Well, experts say that's something you probably won't have to worry about.
So far, the research that's out there says it looks like they may not have to increase Medicare this year. And it looks as if the people that do Part D with Medicare may actually see a 1.8% decrease in their premium cost. The other thing that is happening is that there's going to be a cap on Medicare spending, which for many people will be dollars in their wallet. It's going to drop from $7,000 to $2,000, and that's a maximum out of pocket. So there's some hope there in the midst of inflation.
Remember that Medicare spending cap was included in President Biden's Inflation Reduction Act. The law also reduces drug spending by the federal government. Some TV ads claim that what type of Medicare plan you choose will also impact how much you get in Social Security. Brandon Lewis verifies that.
Medicare open enrollment is coming up, and Verify viewer JB saw this ad about benefits he might be missing out on.
You may be entitled to the Medicare benefit that adds money to your Social Security check every single month.
JB says he's new to Social Security and wants to know if he can really get more money in his monthly check. So let's verify. Are Medicare ads that claim to put money back in your Social Security check true? Our sources are the Centers for Medicare and Medicaid Services, the Social Security Administration, and the Kaiser Family Foundation. We want to tell you up front that this claim needs context. This ad and others like it are trying to sell you a Medicare Advantage plan. That would mean you opt out of your original Medicare coverage and replace it with a plan offered by a private company. These plans are a lot like other insurance plans that you get through an employer or state healthcare exchange. The Kaiser Family Foundation says some cost more, but offer more comprehensive coverage, while others cost less monthly, but might require more out-of-pocket expenses later. This ad that JB emailed us about highlights Medicare Advantage plans that offer a premium reduction benefit. Here's how this connects to Social Security. Let's start with your check. Every month, an amount is deducted to pay for Medicare, and that's it for people on original Medicare. But if you choose a Medicare Advantage plan, it's a bit more complicated. Money comes out of your check for the standard Medicare amount. Medicare sends that money to the insurance company you have your plan with. But if you have a premium reduction benefit, then the insurance company sends some of that money back to your Social Security check. The exact amount varies based on the plan. The downside is that you may end up with a plan that has a smaller network of doctors, or may charge more for procedures than original Medicare. So while you may get more money in your Social Security check, it could cost you more in the long run, which is why this ad needs context. So just like when selecting a health insurance plan through your employer, it's important to consider your expected needs and financial situation when choosing whether to switch to a Medicare Advantage plan. Medicare offers a comparison tool on its website to help you decide whether switching plans makes the most sense.
So all of this is for the needs of people on Social Security right now. But what about down the road? Is this program going to be there for the next generation? The latest annual trustees report for Social Security said its trust fund that pays out the retirement and survivors and disability benefits and all of that, it will be able to pay scheduled benefits on a timely basis until 2035. After that, incoming taxes, cash from taxes, will be just enough to cover 80% of scheduled benefits. It is not clear how long that 80% level could last. One thing that is clear, though, we've all paid into this program. We all want it to work its best as a result. That's why we're going to keep digging into it right here